The ACE phoneme identification test assesses the listener's capability to identify sounds that only differ in their spectral content. A limited number of phonemes are presented several times each, in random order. The default presentation level is 70 dB. For instance, these 3 phonemes can be presented 5 times each. The phonemes are constructed in such a way that the only difference between different phonemes is the spectral content. Both duration and loudness are equal. The listener has been familiarized with the set of phonemes during the training. It is a closed set. After each presentation, the listener should identify the phoneme. Adults may repeat the phoneme they have just heard. For children, pictures have been added that correspond to each phoneme. The child is asked to point the picture that corresponds to the phoneme he or she has just heard. Pictures can be mouth images, or images of which the phonemes are onomatopoeia. Children with hearing impairment may be familiar with mouth images. Onomatopoeia are vocal imitations of the sound associated with the picture. For instance, A may be associated with opening the mouth during medical examination. When all phonemes are presented a preset number of times, a confusion matrix can be drawn. This shows how often each phoneme was correctly identified, or identified as one of the other phonemes. How to use and interpret the test results. Since this test is an identification task, a good result requires detection of the sounds, discrimination of the sounds from one another, and correct cognitive labeling of the sounds. As said, the only cue to distinguish one sound from another is the spectral content. Therefore, this test requires a good frequency resolving power. This is a feature of the inner ear. A good test result indicates that the frequency resolving power of the inner ear is good. However, failure to perform well may result from bad detection or discrimination. But it may also indicate bad cognitive processing of the sounds. In case of failure, it is therefore recommended to check whether the auditory system discriminates the sounds or not. This can be done with the ACE phoneme discrimination test. In case of good discrimination, the failure to identify the sounds is due to bad cognitive processing. A typical consequence may be to refer the listener for auditory training. If the listener fails to discriminate the sounds from one another, the typical consequence may be to change the programming of the auditory device. This is explained in the Rationale video that comes with the ACE discrimination test. As an identification task, this test can replace other and more commonly used identification tests in challenging situations. Speech audiometry is such a commonly used identification test. Whenever speech audiometry is difficult to perform, the ACE phoneme identification test may still be feasible. This may be to perform an identification task in background noise or in young children. Speech audiometry requires a certain level of lexical and other linguistic skills. Especially in hearing-impaired children, these skills may be insufficient until the age of 5 or 6 years. The ACE phoneme identification task requires much less of these skills. It can almost always be performed, starting at the age of 2.5 to 3 years.